Most men think premature ejaculation is about lack of control. But what if I told you it's actually a brain wiring problem and 90% of advice online is completely wrong? Today I'm going to show you exactly how to fix it naturally, medically, and permanently. I had a patient, 28 years old, healthy, gym fit, no diseases. But his biggest problem, he couldn't last more than 40 seconds. He tried everything, sprays, pills, random YouTube advice. Nothing worked until he fixed one hidden cause. By the end of this video, you will learn why it's happening, the 3 natural fixes that actually work, and the medical treatments doctors don't explain properly. Stay till the end because the last method is what cured my patient. Premature ejaculation is not just physical. It's controlled by your brain, nerves, reflex system. Your brain is basically saying, finish fast, urgent. There are 3 main causes. Number 1, hypersensitive nervous system. Number 2, anxiety, performance, pressure. Number 3, dopamine overload. Yes, from screens. Here's the scary part. The more you rush, the more your brain learns to finish fast. You're literally training yourself to fail. But here's the good news. If it's learned, it can be unlearned. Let's fix it. The stop-start technique. When you feel close, stop. Wait 20 to 30 seconds, then start again. This retrains your brain. But most people do it wrong. They stop too late. You must stop at 70%, not 95%. The squeeze technique. Apply gentle pressure just below the head. This reduces the reflex instantly. But here's the upgrade. Combine stop plus squeeze. That's where real control starts. Pelvic floor training. Kegels. These muscles control ejaculation. Strong muscle is equal to better control. How to do it? Contract like you're stopping urine. Hold 5 seconds. Relax. Do 10 reps 3 times daily. Most men ignore this, but this alone can double your control. Yes, double. If natural methods aren't enough, we go medical. But listen carefully. Not all treatments are safe long term. Number 1, topical anesthetic creams and sprays. They reduce sensitivity, but too much is equal to zero pleasure. Number 2, medications, SSRIs. These delay ejaculation, but they affect mood, libido, and brain chemistry. Doctors rarely tell you this. These are not first-line solutions. They are backup tools. Best approach, combine brain retraining, muscle control, and selective medical support. That's how we treat it professionally. Now the real reason my patient improved. His brain was overstimulated. Constant dopamine spikes destroyed his natural control. We reduced stimulation, reset his brain. He lasted 5 times longer. Here's your exact plan. Train, stop, start daily. Do Kegels 3 times a day. Reduce overstimulation. Use medical support only if needed. If you follow this, you will see results. This is not theory. This is clinical reality. You are not broken. You're just untrained. And now you know exactly how to fix it. If this helped you, subscribe to Dr. Junaid Rasool for real medical truth. And comment control if you are starting today.